All right, so we're going to continue talking about kidney disorders, and at this point, we're going to focus on kidney stones. So the different types of urinary obstructions can happen because of a lot of different reasons, right? So some of the reasons can be anatomic, right? Some of it can be functional, some of it is congenital, and some of it is acquired. So whatever is causing the obstruction, what we're worried about is the area above the level of obstruction. And the damage that occurs above the level of obstruction will basically depend on where the obstruction is. So the location, the duration, the amount of pressure, the amount of dilation that happens because of the obstruction, whether or not there's urinary stasis or whether or not there's an infection, all of that will impact the amount of damage that actually happens anywhere within the urinary tract. All right. The obstruction can happen in one kidney, it can happen in both kidneys. If it's just one kidney, then the other kidney may try to compensate, basically, so maybe the patient may not even have any symptoms right away. So all of that is possible. So this particular picture is just showing you all the different areas where the obstructions can happen. So you see here that in the pelvis, you can get things like calculi or tumors. And in the ureters themselves, you can also get the same things like calculi, tumors, clots, or even inflammations. They've decided to describe some of the factors as either intrinsic and some of the other factors as extrinsic. So an extrinsic type of obstruction could be caused by pregnancy, or maybe somebody has a tumor in the cervix, then they would consider that to be an example of an extrinsic type of obstruction that's happening. You see that you can also get like a narrowing of the uterovesical junction. So you're having the ureters here going into the bladder, so this may narrow, and that could be a problem. Within the bladder itself, you can also get weird things like, calculi or tumors themselves that are there. You can have other problems where you have things like hyperplasia, right? Like BPH, right? Or maybe you even have things like urethral strictures, right? So there's just so many different areas where you can end up with obstructions. And the main point to remember is that if you have an obstruction, basically that means the urine is not able to flow forward. So a lot of damage will be happening above the level of obstruction. So the way that the different types of obstructions can vary, it could be the bladder neck itself that is the problem, right? So you know how you have the bladder and then below that you have the prostate, right? So that could be the problem. So it's lower in the urinary tract area there, and then the detrusor muscle basically hypertrophies, and then the end result is that you're ending up with a residual amount of urine that's basically being left in the bladder, right? So you're going to look at your anatomy once again so you can follow all of this. The other issue is you have the ureters that are basically leading into the bladder. But if there's some type of obstruction there, then you're going to be getting a lot of pressure that's going to happen, and then you're getting a backflow that happens. And if you're getting this backflow, you're getting things like hydroureter, and you're getting things like hydronephrosis. And then the end result is that you can end up with like things like chronic pyelonephritis, and basically your renal pelvis becoming atrophied. All right, because the urine is not moving forward like it should be. So this is just a picture of somebody that has hydronephrosis. Okay. So this is just the different areas where you can get obstructions once again, right? So the other one was between the ureters and the pelvic area, right? So therefore what's going to happen is your kidneys are going to be dilating, and you're going to be getting weird things like urinary stasis and reflux, and you're going to be getting risks of things like pyelonephritis, right? If both kidneys or only one functioning kidney are involved, you're going to definitely start seeing changes in the BUN and the creatinine, right? And these numbers will be elevating. If it gets worse, then obviously you can end up getting things like renal failure. So that is the biggest problem. Okay, so the treatment pretty much for all the obstructions is going to be finding and relieving the blockage, whether we need to put in a tube, maybe we need to do surgery, or even do something like a urinary diversion. So all of that is going to be similar for all of these different types of obstructions that we may have. So we're now going to start talking specifically about kidney stones, and you see here that the term for it is nephrolithiasis, right? So in the United States, apparently 13% in men and 7% in women. Middle age primarily increases with age, risk factor, and then more frequent in whites than blacks, Hispanics and Asians, those with a family history, and then you have all these different areas in the United States where it happens the most. Summer months, because of the hot climate and dehydration, maybe people are not drinking enough. And apparently in Jewish men, they're more at risk for uric acid stones. All right. And then there's a chart also in your book that you just want to look at very briefly that is highlighting some of this different types of health disparities that are going on. Okay. We are going to look at the risk factors in table 45.10 together in class. I want you to look at the factors ahead of time because you do have to be familiar with these different types of risk factors. At the end of the day, to make this very easy, it's literally the fact that you're getting a concentration of supersaturated crystals, right? You're getting a precipitation that happens, and then you're getting stone formation. So some of that can happen because there's an infection, there's some type of bacteria, and that is very unique for the struvite types of stones. Some of it has to do with too much uric acid. Some of it has to do with too much, the fact that the concentration is too alkaline. So it's just a whole bunch of different variables why somebody's ending up with kidney formations, kidney stone formations. So we will unpack all of this together in class. And in the chart, the table for the different types of stones that can happen, I want you to just to focus at the very end of it where it's talking about treatment. You're going to see that primarily for all of it, you're doing hydration is the main thing. And I want you to focus on that. And then whether or not if it's a uric acid type of stone, there's different diets, right, that we have to focus on. And if it's a struvite stone, they're talking about giving maybe antibiotics or certain types of medication that the patient needs to be getting, right? So I just want you to notice the little things that are unique, okay? Otherwise, it's just kidney stones in general, and then we're just looking at the little pieces that may be a little bit different. So there's just a whole bunch of different things that basically can influence why somebody ends up with a kidney stone, right? So you have weird things like the urinary pH. So apparently if it's a higher pH, calcium and phosphate are less soluble, and therefore you can actually end up with crystallization. If the pH is too low, uric acid and cysteine apparently are less soluble, and therefore you can still end up with crystallization. So the job is to find the correct medium so that we do not end up with crystallization. So in order to do that, really a lot of it has to do with drinking enough water. So drinking enough water, making sure that the urine is dilute, making sure that our diet doesn't have too much of concentrated types of things like sodas and too much meats, in particular for the uric acid types of stones, all of those types of things. So there's a lot of different influencing factors. So the urinary pH is a factor. Too much solute is a factor. Maybe there's some type of obstruction where urine is not moving forward. That's an issue. For the struvite stones that I mentioned earlier, bacteria is the main problem, right? So the different types of bacteria can cause the urine to become alkaline, and then that can actually lead to struvite stone formation. And then there's some other things like genetic factors as well that have been implicated. All right, so this is the table 45-11 in the textbook. So like I said, I want you to look at the chart and then we'll talk about it, and then we'll discuss the treatment for each of these, right? You're going to notice that primarily it's hydration, 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 but for the struvite in particular, there's medications that they're giving, and then for the uric acid, it's particular diet modifications that they're saying that you need to be making. Okay, When somebody has a kidney stone, the first symptom is sudden severe pain. They're calling this renal colic, and it can be in the flank area, the back, or the lower abdomen. Basically, the ureter is stretching, it's dilating, and it's spasming out. The patient has a really hard time being comfortable, and they call this, they do the kidney stone dance, right? They'll sit, they'll stand, they'll lie down. They're just really, really hard for them to be comfortable. You may also see things like nausea and vomiting, dysuria, fever, chills, moist skin, all of that. The common sites of obstruction, so it's the ureter and the pelvic junction area. Okay, and if that's where the stone is lodged, you're going to be seeing a dull coastal vertebral flank pain or renal colic. That's what the patient will primarily be complaining of. If it's the ureter vesical junction area, the patient will be complaining of lower abdominal pain, testicular pain, or labial pain if they are female. So testicular for men and labial pain if they're female. So you do have to have a sense of what some of the clinical manifestations look like. These are all the different diagnostic studies that they can do. The end result is they just want to find out what the type of stone it is, because then they can figure out, okay, how can we stop the patient from having this particular stone formation from happening. So that's the end goal that we're looking for in terms of the diagnostic studies. So in terms of managing the kidney stones, well, it's about managing the pain, right? So first thing is we want to manage the acute pain. So that's going to look like opioids, NSAIDs, or alpha-adrenergic blockers, right? That's what we're going to be doing. So managing the acute attack, right? And then the second thing is we're going to evaluate the cause of the stone formation and prevent further development. So that's literally the nursing assessment, family history, what are they eating, activity pattern, are they, getting in and out of bed, pretty much what are they eating is like a really, really big one. How do they have any other GI or GU disease? Have they had any surgeries recently? All of those types of things you are going to look at to basically try to figure out what is going on with your patient. Okay, and then your treatment, very simple. So adequate hydration, sodium restriction, dietary changes, and then medications, right? So the drugs that they're going to give you, they're going to basically alter the pH of the urine, right? And they're going to prevent excess urinary excretion of particular substances if that is the case, right? And if there's any type of other primary disease, then they'll basically target whatever that primary disease may be. So we will talk in class about what some of these diseases may be. If it's the struvite stones, like I mentioned, then maybe they're going to be giving things like antibiotics because there was some bacterial infections that were there. But the treatment is very easy. So it's hydration, sodium restriction, dietary changes, medications, basically, and then antibiotics specifically for the struvite types of stones. Okay. Stones that are 4 millimeters or less, if you're lucky, they're going to pass spontaneously, and then that's the end of it. If they need to do anything more, then they're going to do things like lithotripsy or even open surgical stone removals, right? So they'll do some type of surgeries. They'll only do that if the stones are too big. So we're considering 7 millimeters or more to be big. Maybe there's some type of bacteria there. And then the patient is symptomatic where now they're getting systemic types of manifestations. Maybe there's impaired renal function. The patient is getting weird things like persistent pain, nausea, or paralytic ileus. So it's just more advanced here in terms of how the stone formation is presenting. And so that's why they'll consider the other different types of treatment. So ideally, you want to have 4 millimeters or less in terms of your stone, and then it gets passed freely by itself. But now we'll consider other types of treatment if we have any of these different conditions that are listed here. So with the cystoscopy, all they're trying to do is just basically remove the stone in the bladder. And then there are different types here. You do not have to memorize these. There's only one that I'm going to highlight in a little bit. So different types of cystoscopies that they can do, but basically the goal is we're trying to get the stone out, right? All right, so once again, just know that these are out there. So these are just two different types of other scopes that they can use to basically try to get rid of the stones. Okay, the lithotripsy. So you're basically trying to get rid of the stones from the urinary tract. The one that I was going to highlight is the ESWL. That's the one that I would like you to focus on. And I have some new pictures that I just found online for you. So this is what your ESL looks like. So it's a non-invasive method for treating stones in the kidney or the ureter. So they're using an energy source, and it's basically generating a shock wave that is directed at the stone. All right. The shock waves are transmitted to the patient using a water-filled cushion that is placed against the skin. So the patient would have like a water-filled cushion next to the skin, and then this is a shock wave. So basically they're being zapped, and then the shock waves break up the stones, and then the patient would, hopefully just pass all of that in their urine, and that will be the end of it. To make sure that the patient stays still, they'll sedate them and they'll put them in a particular position that they want. So there are different images that you can see online if you wanted to see more visuals of this particular ESWL. All right, so that's usually the one that they're asking you about a lot on the NCLEX. So that's the main one that I'm highlighting. Okay. If the patient ends up needing surgery, so basically they're doing some type of incision to remove the stones, right? And the type of surgery is going to depend on the location of the stone. So obviously nephrolithotomy is an incision made into the kidney. Pyelolithotomy is an incision into the renal pelvis. And then ureterolithotomy is incision into ureter. And then bladder cystostomy. All right. So they'll do the surgery, and the biggest complication for all of these is the hemorrhaging that can potentially happen. Okay. In terms of nutritional therapy, so if there's an obstructing stone, you want to make sure your patient is adequately hydrated. We don't want to force fluid. We don't want to give them too much of the fluid because that can actually increase the pain. But we want to make sure that they have enough hydration anyway, because if you're lucky and it's a small one, you're giving them enough hydration, they'll be able to pass it. Obviously, if it's too big, we have to use some of our other treatment options that are available to us. After the patient has had the urolithiasis, so still high fluid intake, at least 3 liters a day, because you want them to be peeing out a lot. Water is best. You want to prevent the supersaturation of minerals. You want to reduce the risk of dehydration as well. You're limiting weird types of foods, so things like colas and coffee, because they may cause increased stone formation. Low sodium diet, because that will increase things like fluid retention as well, and put a strain on the kidneys, right? So dietary restrictions are our go-to. So specifically for these types of stones, like the purine, calcium, and oxalate types of stones, diet tends to be the main treatment for those types of stones. But in general, guys, hydration, 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 hydration. Specifically for the purine types, is the meats. Let's see, like meats, proteins, right? Those types of things. Drinking. We've covered, I think, purine types of foods already under neural. So all of this should be very familiar to you. All right. And then the rest of it is just easy. You're just doing your assessment, and it's pretty much the same for all your kidney disorders. Okay. Everything is the same here. Okay. Some of the nursing diagnoses are actually going to look exactly the same like the other ones we were talking about earlier. All right. But now the only difference is we're talking about stones, so it's all about relieving the pain, making sure there's no urinary tract obstruction, and then making sure you're teaching your patient to prevent recurrence of stones.